One thing that I am very passionate about and work through UMass is a program called Kids Comfort Promise, and it is a program to decrease needle stick pain. And while our program is for all children, I think it's a really important piece of chronically ill children's care. And my hope is in the future that we continue to grow and expand and create an even more comprehensive program that we can get outside of the walls at UMass. Because as I spend a lot of my time doing, the data and research is there of ways to make needle sticks not hurt as much and be less stressful. And I think we as a medical community are really bad about actually implementing these things. So part of my passion is to improve needle stick experiences. And kids with chronic illnesses are having so many needle stick experiences. And whether they can express their dislike of it or not, it's painful, it's anxiety producing. It's anxiety producing for families, parents watching their children have to go through multiple sticks. And it's not that I have like the magic thing that makes it all better, but there's a lot out there about simple tools and techniques that can be used to make needle sticks better. The use of numbing cream is so underused. It takes time, so we don't do it. Parents often don't even know that it's an option, even though it is, but you need the right people to help you get the cream and know where to put it and be willing to do a poke when there's cream having been on the skin. We have a shot program that we're really trying to develop, which is a little bit different than our like blood draw and IV, because the techniques are a little bit different. For shots, there's this cool thing called shot blocker that most people haven't heard of. Shot blocker is this little yellow disc with bumps on it. It's a C shape. So when you get an injection, you clean with alcohol and you press the shot blocker onto the skin. So there's a little space in the middle that's open that the injection can be done. Those little nubbins press into the skin and the nerve is distracted by the nubbins. So the brain can't process the poke of the needle as much. We buy them by the 100. They're like 20 cents a piece when we buy them by the 100. You can go onto Amazon and buy one for $5. So shot blocker, Buzzy. Buzzy's really underused. It's a little vibrating puck that creates distraction on a nerve path. So if you're having an injection, Buzzy can be held above and it's just creating vibration. I don't know if you've ever gone to the dentist and when they're injecting the Novocaine, they use their hand and they create vibration. It's the same thing. So creating another stimulus at the same time that the injection's happening is really helpful. Buzzy can be used for IVs and blood draws too. It's just held a few inches above where the poke is happening. Numbing cream is crucial, extremely underused, and not well understood. Like a lot of families, unless you have a port, I think it's used when kids have ports. And for our hematology and oncology patients, really, I have to say mostly just the oncology patients, the oncologist will push for numbing cream to be used.